Good afternoon. I know the hour is late. My request from ACVIM was talking about hyperbaric oxygen in internal medicine. So this is going to be a much broader view, but I think you're going to find it extremely interesting. First of all, how many people in the room practice with a chamber? 1, 2, 3. That's great. Also, I want to bring to your attention on my bio, the last number of letters behind my name, CHT-V, is a new approved veterinary certification for hyperbarics. It is hyperbaric technician, veterinary, certified. This is something that you all can be certified in. It's something you should pay attention to, and provided by the National Board of Diving and Hyperbaric Medicine. What I want to talk about is a large question that I have in my mind, and that's the difference between human hyperbarics and the amount of treatments we find in this country and around the world in veterinary hyperbarics. What you're seeing here is multi-place chambers. These chambers allow multiple people going inside a chamber. The chamber is filled with air. And as you see in the top photo, there's little space-age hoods over the patients inside the chamber, which is filled with oxygen. It's much cheaper and much safer than filling a gigantic vessel with oxygen. These are what monoplace chambers look like on the human side. There are thousands of these chambers around the United States. One person goes into each chamber one at a time. Here is a gigantic human chamber, 40 inches diameter, being installed in the Jupiter Medical Center. This is the largest monoplace chamber that we have manufactured in the world. This chamber has been used predominantly for research and development in the bariatric surgical sector of the Jupiter Medical Center. They made them so large because some of the patients are so huge, they can't fit into a regular chamber. But the question at hand is, why are there so few veterinary chambers? This chamber was manufactured in the early 70s. Imagine squeezing yourself into that. This chamber is in Broome, Western Australia. There's also one of these you can actually see in Isla Mirada, Florida. And this was predominantly for decompression disease, divers who came up too quickly. But that's thousands of chambers treating thousands of people every day, but less than 50 chambers in the veterinary community across the country. And the question is why? This is a C-class chamber. It is for animals only. It's the chamber that's manufactured by Hyperbaric Veterinary Medicine. But the question still remains, why? One reason is when I went to vet school, they didn't teach us about hyperbarics. There's only 2 vet schools in the country right now that teach hyperbarics and that have hyperbaric chambers. It's Tennessee and Florida. Probably part of the reason may be that during the 70s there were many new innovative and effective therapies that became available. Possibly also efforts to overuse it for various medical conditions proved unsuccessful in the early 70s. And then there were rogue physicians who were high-profile HBOT advocates that probably damaged its reputation early on. But the science prevails. Veterinarians understand that most medical problems are not uniquely human, nor are most of the treatments. And that's kind of what I'm trying to bring together here. Dr. Barbara Naderson-Horowitz, a cardiologist at UCLA Medical Center, coined the term zoobiquity to describe the idea of human physicians looking to animals and the doctors who care for them, veterinarians, to better understand human health. Veterinary medicine had not been on her radar until about 10 years ago. That's when she was asked to join the Los Angeles Zoo as a medical advisor. And she began hearing about congestive heart failure in gorillas, leukemia in rhinoceros, breast cancer in tigers, pandas that got eating disorders, or flamingos that got heart attacks, and koala bears that got STDs. Veterinarians understand the similarities between animal and human disease, and also understand the similarities in the treatment of these diseases. We often use human drugs that haven't been tested or approved, but we use them anyway. So the point here is not needed to reinvent the wheel. We should look at the science of hyperbarics on the human side for our direction. So let's look at the reverse for a moment in regards to HBOT. What conditions did the FDA approve for humans that we can assimilate into the veterinary medicine market? Before we do, just realize that the FDA and the Undersea and Hyperbaric Medical Society is an organization representing physicians and nurses and technicians in the field of hyperbaric medicine. Oxygen cannot be patented. Profits on the sales of oxygen are too small to pay for studies that meet the FDA requirements. Human and medical insurance companies commonly take the position that the FDA has not issued formal approval. So the 14 below indications have been detailed in physiology, medicine, and clinical evidence. This means that these are what the FDA believes is indicated and insurance companies will pay for the treatment of hyperbarics in humans. So, air or gas embolism, carbon monoxide poisoning, clostridial myositis and myonecrosis, crush injuries, compartment syndrome and other acute traumatic ischemias, decompression sickness, enhancement of healing problem wounds, diabetically derived illnesses, exceptional blood loss, intracranial abscess, necrotizing soft tissue infections, osteomyelitis, delayed radiation injury, skin grafts and flaps, and thermal burns. So what does this look like in veterinary medicine? So what you see here is a chest x-ray of a 5 to 6 month old male domestic short-hair kitten presented for neuter or declaw, died on the table. Cat was normal on physical therapy prior to surgery. There is air in the cranial vena cava, there's air in the right side of the heart, and there's air in the liver. Where did these come from? Most likely an IV line. But other ways that air can get inside your patients: injection, lung trauma, diving, explosions. Hyperbaric oxygen therapy is used to reduce the size of these bubble circulating blood vessels. HBOT for carbon monoxide poisoning. There is more cyanide in smoke than carbon monoxide. It's very sobering to realize how many people and pets are affected by carbon monoxide every year. We provide veterinary oxygen masks to the fire departments in our community and remind them to bring any pets found at our fire site with suspected smoke inhalation to our hospital for HBOT. HBOT for gas gangrene. The black necrotic tissue with evidence of gas-producing bacteria in the mammary gland warrants immediate surgical intervention. There is gas gangrene in these glands. We see this. HBOT, in conjunction with surgical debridement, will provide a better outcome. And used prior to surgery may indicate more clearly the line of demarcation between viable and unviable tissue. HBOT for crushing injuries. The crushing injuries on the veterinary side caused by hit by car and by bite wounds. We see these every day. This dog bit into a chainsaw that was on. I thought this was really interesting because I was going to say, how could we talk about H-bud and decompression disease, but look how many people are teaching their pets how to dive. I was astounded. This is just a matter of time before there's going to be an accident. H-bud for arterial insufficiencies. On the human side, this is huge, especially for diabetic foot ulcers, and has prevented numerous amputations. Here are some of the veterinary cases that would benefit. Problem wounds. More problem wounds. H-bot for severe anemia and acute blood loss. Hyperbaric oxygen treatment is equivalent in wholesale cost to a unit of packed red blood cells in the Western world. By controversy, but true, hyperbaric oxygen provides a low-technology, cost-competitive means of pharmacologically reducing accumulated oxygen debt in the anemic, injured, or critically ill patient with little side effect. If hemoglobin falls rapidly and symptoms of cerebral anoxia appear, intermittent hyperbaric oxygen therapy will have a striking effect on the cerebral symptoms and keep a patient alive during a critical period. In 1960, an experiment by a Dutch doctor put a pig in a hyperbaric chamber, pressurized it to 3 atmospheres, which is equivalent to being at 66 feet under seawater, replaced its blood with saline. The amount of oxygen dissolved in the saline kept the pig alive in the chamber without blood. At the end of the experiment, the doctors took the pig out, replaced his blood, and the pig survived. H-bot and intracranial abscesses. An accumulation of infected material, these abscesses in the brain are common in patients with head trauma. Another FDA-approved use for hyperbarics. Hyperbarics for necrotizing soft tissue infections. Could be from flesh-eating bacteria that usually progresses very rapidly. We've all seen cases that are similar to this in our practices. Indications for hyperbarics that are approved. Hyperbarics for osteomyelitis. Hyperbaric oxygen appears useful for the treatment of osteomyelitis for a lot of reasons. One of the big ones is Pseudomonas does not like to live inside hyperbarics. It also increases the oxygen tension in infected tissue. Adequate oxygen tension is necessary for oxygen-dependent killing of organisms by leukocytes and for fibroblast activity lending to angiogenesis. Betsy talked about radiation. Hyperbarics for post-radiation injury, radionecrosis, radioosteonecrosis. Soft tissue radiation necrosis and radioosteonecrosis are common sequelae for the radiation patient. And they benefit extremely well from hyperbarics. New evidence has been shown that if you hyperoxygenate a patient in a chamber just prior to radiation, you enhance the radio effect and you have much, much less collateral damage. If you perform radiation, you should have a chamber in your practice. Hyperbarics for compromised skin grafts and flaps. Those of you that see grafts and flaps medically after surgeons have completed their advanced arts and crafts, put them into a chamber to enhance the angiogenesis and oxygenation of the wound edges. These tissues are severely traumatized, and they need all the help they can get. H-bot also decreases edema along the tissue margins. Hyperbarics for thermal burns. I don't have to talk to you about burns. You've seen burns. This is a case that was in my hospital. A third of the body was burned. The dog was found in the streets of Miami covered in maggots. All we did is debridement in this dog and hyperbarics with a little bit of Silvadene. Day 2, day 7, day 20, day 30. This one I really couldn't find comparisons, but I did find an interesting photo. hyperbarics for idiopathic sudden sensory neural hearing loss. They're using it in people. I'm not sure how we can yet integrate it into veterinary medicine, but someone will figure that out. So those were all indications that the FDA and insurance companies are paying, and thousands upon thousands of people are being treated daily across our country. And there's less than 50 chambers in the veterinary community. The following indications have been introduced due to a growing body of evidence in support of using hyperbarics. Stroke, multiple sclerosis, head injuries and contusions, infections, Lyme's, heart attacks, chronic fatigue, ADD, ADHD, sports industry. The list goes on and on. Crohn's disease, fibromyalgia. Aetna Insurance, one of the largest in the United States, considers the use of hyperbarics experimental and investigation for these conditions plus about 100 others. There's still some insufficient evidence, according to the FDA standards, in the medical literature establishing that systemic hyperbaric is more effective than conventional therapies. But the evidence on a daily basis is growing. Veterinarians have the ability to pioneer this work. If a window of opportunity appears, don't pull down the shade. For some of these indications, accumulating evidence may continue to support the effectiveness of hyperbarics. Advantages of adaptive licensing. The basic concept is, the heart of the adaptive licensing approach is that the review process should be a learning system. It shouldn't take $1 billion to prove the minutiae within FDA. Breakthrough therapies would be made much available to patients much earlier in the regulatory process. So don't let the mandated evidence slow down the research. The reviews should be clear, present, and the recommendations consistent with the evidence. Veterinarians have the ability to pioneer these indications. So these indications I'm talking about right now are the ones that FDA has still not approved, but the evidence is becoming overwhelming. Stroke. Stroke is an ischemic event. In a review of 222 patients, the American Stroke Association suggests that a significant number of these patients with completed stroke will benefit from hyperbarics. The otherwise normal cells in an ischemic event go dormant because they cannot function without appropriate oxygen. When the cells in the brain or elsewhere die, either from trauma or lack of oxygen, blood plasma leaks out into the surrounding brain, causing tissue swelling and reduced blood flow. HBOT dramatically increases the oxygen carried in the blood plasma. These are post-metabolic areas of uptakes, the ones that show pre and post. The uptake is orange. So why not use hyperbarics in heat stroke, spinal cord stroke, FCE, vestibular disease, cerebral vascular accidents, transic ischemic attacks? Personally, after I have observed my patients in hyperbarics, and I've been treating patients for over 4 years, if anyone ever near and dear to me had a stroke, they would be treated conventionally, but they would also get into a chamber as quickly as possible, because in my belief, it will increase the maximum medical recovery. Hyperbaric oxygen treatment in post-operative neurosurgical infections. Not just infections, but just post-neurosurgical surgeries. But HBOT for neurological applications is a common practice around the world. Probably more common in Russia, China, and Japan. Published research on HBOT in a wide variety of acute and chronic neurological diseases. The general finding has been successful therapy with high-pressure HBOT in the first few hours after a cerebral insult, and then tapered to low pressures in the weeks and months to follow. 39 consecutive patients, Larson Engström in Sweden. Objective to evaluate the clinical usefulness of hyperbaric oxygen. Conclusions. HBOT is a safe, powerful treatment for post-operative cranial and spinal wound infections and should be included in the neurosurgical armamentarium. I found this to be really interesting. A review of systemic
inflammatory bowel disease, 13 studies of HBOT and Crohn's disease. And this is touching everybody because you all know people who have these diseases. How do we manifest it into veterinary side? Crohn's disease is considered to be an autoimmune in origin. There's increasing evidence it may have an infectious cause in addition. HBOT lowered the markers of inflammation and oxidative stress and ameliorated IBD in both humans and animal studies. Most treated patients were refractory to standard medical treatment. This is interesting. We all know leg-calf-perthes disease. In this study out of Israel, for avascular necrosis of the femoral head, 81% of the patients who received HBOT showed a return to normal on MRI compared to 17 in the untreated group. Potential effects of hyperoxygen therapy in acute pancreatitis. Acute pancreatitis impairs the pancreatic microcirculation, causes acute inflammation. 20 to 30% of the patients develop pancreatic necrosis. These processes are ischemic in nature and potentially improved by driving oxygen into the ischemic tissues and currently reducing pancreatic inflammation-associated pain. When I have a pancreatic, I'm also a practitioner. I know that they didn't use that as my introduction. I have a practice in Boca Raton, Florida, and I've been using hyperbarics there for 4 years. If I take a pancreatic patient and I put it in my chamber, and that dog is standing there, splinted abdomen, really uncomfortable, during the 45 minutes he's at pressure, you wind up seeing them become comfortable. They lie down, they curl up. They are relieved of the tension and pain inside their belly. This is an interesting study, Cardiology Review 2009, and I'm going to put a little footnote in here. There's a lot of encouraging work with regards to hyperbarics, and it's used in conjunction with thrombolytics to reduce the magnitude of injury in patients with acute myocardial infarction. Keywords here are HBOT in conjunction with thrombolytics and reperfusion injury. This is all about how to decrease reperfusion injury, and HBOT plays a major role in preventing reperfusion injury. This guy got beat up on the football field for many, many years. Football legend Joe Namath helping to bring publicity to treatment of brain injury with hyperbaric oxygen. Researchers discovered that hyperbaric oxygen was helpful for a host of other conditions, including brain trauma, stroke, multiple sclerosis, cerebral palsy. I've seen some amazing effects with that. Autism in children and Alzheimer's. Namath underwent 40 sessions of hyperbaric oxygen therapy over a period of 6 months. And his doctor says that they haven't seen an improvement in traumatic brain injury as substantial that they have seen in this sports hero. Lyme disease. Although additional statistic evaluation is still being carried out, it appears that approximately 84% in a almost 2,000 treatment study in 91 subjects, 84% of these treated showed improvement by a decrease or elimination of symptoms. It's thought that the Lyme bacteria can't survive in hyper-oxygenated environments over 2.3 ATA. Personally, I normalized IDEX Lyme quantitative C6 results in 30 days with a combination of doxy and hyperbarics. Stem cells. This is a whole different world. Steve Tom et al. 2005 at University of Pennsylvania, over a course of 20 HBOT treatments, increased CD34 stem cells. The CD34 stem cells are the primitive blood and bone marrow-derived progenitor cells, 8-fold. 20 dives increases your stem cells 8-fold. I did a very, very interesting study. It was based on an experiment in Argentina on type 2 adult onset diabetes in 30 people, most of which went into some duration of remission. somehow turning the insulin switch. Remember, dogs are like type 1 diabetics. Pancreas doesn't produce insulin. Cats are like type 2 diabetics. They just can't get the insulin absorbed. The study was dogs and cats given 5 doses of hyperbarics, 5 days in a row, then given 7 days of a granulocyte colony stimulating factor, and then 5 more days of hyperbarics. So it was a 17-day treatment. All the cats in this study went completely into remission, no insulin for 6 months. The dog's insulin level actually decreased. So with regards to stem cell and what it does inside the body, we have pathways of pioneering we don't know the answers to yet. So remember, this is a drug. How does it work? The mechanisms: hyperoxygenation, angiogenesis, fibroblast proliferation with collagen synthesis, and vasoconstriction. Also, leukocyte oxidative killing, reduces leukocyte intravascular adherence, reduces lipid peroxidation. That refers to the oxidative degeneration of lipids resulting in cell damage found in inflammatory bowel disease, kidney damage, Parkinson's, asthma, and others. Toxin inhibition, and it synergizes antibiotics. Additionally, evidence is growing that H-body alters the levels of pro-inflammatory mediators and blunts the inflammatory cascade. More studies are needed to further elucidate this complex interaction. But one of the things that Betsy said earlier are that many of the veterinary pet insurance companies are paying for hyperbaric oxygen, and they're not really interested in the fact that it is used for an FDA-approved indication or not. So we need to pioneer the science into the direction that makes the most sense with clinical evidence on hand. This is what I wanted to share with you. A lot of you have seen this photograph in the last day. This dog had its muzzle tied with duct tape.
A man who North Charleston police say taped a dog's mouth shut because it wouldn't stop barking, still in jail on $50,000 bond this afternoon. William Dodson, whom you see here, charged with animal cruelty. Court papers state Dodson also chained the dog in his backyard, but she somehow broke free. Meanwhile, the dog, named Caitlin, is being treated at a veterinary specialty care center in Mount Pleasant. That's where we find our police reporter, Harv Jacobs, with a very special guest this afternoon. Harv, who do you have there with you?
Well, Bill, take one guess. It's Caitlin. We have her live and alive, thank goodness. Here she is. Sweet, beautiful dog. You can see the injuries on her muzzle. That's where the muzzle was taped shut, allegedly by William Dodson, and she seems to be doing okay considering what happened to her. With us right now, Dr. Henry Bianucci, who's one of the owners here of Veterinary Specialty Care in Mount Pleasant. Doc, the world wants to know, how's she doing?
I think she's doing great. She has responded very well to the wound treatment that she's had so far. She's had a combination of serial wound debridement, which means we're taking away the dead tissue and seeing what's going to live and what's going to die. I think we're down to good tissue now, and she's going to get a definitive surgery tomorrow to close up the open area on her cheek.
What kind of injuries does she have?
She has a serious laceration on her left side, which is right at where the upper lip joins the lower lip, and she has lost part of her tongue. So part of the tongue is going to be excised tomorrow, but not much. There's, as you might be able to see when she's licking there, a lot of it has come back. She's had hyperbaric oxygen therapy and laser therapy, and I think those modalities have both helped to enhance that tissue recovery. So it's going to minimize how much surgery we have to do.
Let's quickly show this is a hyperbaric chamber. How does this work basically?
This is basically 100% oxygen-rich environment under pressure. This is the same machine that you would get put in if you had a diving accident and developed the bends, which is nitrogen narcosis. It puts the body under pressure and it hyperoxygenates tissues. It has a profound effect on swelling, wound healing, and tissue regeneration. And so it's been a big part of her recovery again, along with the laser treatment, and along with these smaller surgeries, these debridements, making it so really by the time we do the surgery, it's going to be far less than would have been the case otherwise.
And you expect soon she'll be able to go to a foster home, hopefully?
My guess is in a couple of weeks she should be ready to be fostered out. Yeah, she's a very sweet dog. She's got a little bit of anxiety, understandably, about men, because I don't know who did it exactly, but that's the assumption. So yeah, but she's a very sweet dog, and she's bonded already with our technicians.
And you told me very quickly if she hadn't been found when she was found a few more days, we would have had a tragedy.
I don't even think it would have gone a few days. I think she would have either overheated due to an inability to pant. She would have become dehydrated because she wasn't able to take in any water. That's really what would have killed her first, either dehydration or overheating.
Well, thank goodness, Doc, great job by you all. What an outpouring of support from the world for Caitlin. And I could tell you this much, there's going to be a long line of people who want to adopt Caitlin. Live from Mount Pleasant, Harv Jacobs, Live 5 News.
So basically, at the end, it's food for thought, a discussion to nourish your mind and bring new ideas to your practice. Thank you all very much.